Good afternoon and good evening to everyone on the line today. Warm welcome and thank you all for joining us for this webinar to launch the UNFPA Supplies Partnership Annual Impact Report. My name is Pape Gaye, and I'm the independent chair of UNFPA Supplies Partnership. Before we dive into the heart of our webinar, let me just cover a few housekeeping. This is indeed an exciting lineup of speakers, and we have looking forward to discussions ahead. We have some brief housekeeping notes that I would like to cover. Our webinar offers simultaneous interpretation in Spanish and French. If you would like to listen to the webinar in Spanish or French, please click on the interpretation button on the bottom of your Zoom screen and select the language of your choice. We also hope to hear from all of you during the webinar, and we'll have an opportunity for questions and answers later in our program. To participate in the Q&A, please type your questions into the Q&A box on the bottom of your Zoom screen, and we'll do our best to have our speakers respond to them. Now, I am delighted to invite Mrs. Diene Keita, United Nations Assistant Secretary General and UNFPA Deputy Executive Director for Programs, to provide welcome remarks. Please join me in welcoming her to the floor. Diene, over to you.
Thank you so much, Pape. Warm greetings, dear partners and colleagues. Very happy to be with you this morning. Pape, we very much appreciate your continued stewardship as independent chair of the UNFPA Supply Partnership Steering Committee. We are very grateful. Allow me to extend a special greetings to our honored partner speaking today, Dr. Thomas Sesay, Director of Reproductive and Child Health, Ministry of Health and Sanitation, Government of Sierra Leone, Dr. Flores, Ministry of Health in Honduras, Ms. Kadra Noor, International Rescue Committee, ERC South Sudan, and Mr. Chris Carter, UK Foreign Commonwealth and Development Office, FCDO, Deputy Director and Head of Human Development Department. Indeed, a warm welcome to everyone joining online from around the world. Thank you for joining us to celebrate the success and impact of the UNFPA Supply Partnership. As you know, the UNFPA Supply Partnership is a global health initiative that brings together national government, international donors, NGOs, implementing partners, civil society, organizations, and multilateral agencies to strengthen health system. We do this together by improving supply chain, advancing policies, diversifying financing, and expanding access to quality assured contraceptive and maternal health medicine that improve the lives of everyone, particularly women, girls, and young people. The Supply Partnership is responding to the needs of people in diverse national contexts, ranging from countries facing high maternal mortality, rapidly growing population, and also grappling with issues like conflict, climate change, and humanitarian emergencies. We are proud to work hand in hand with countries that experience the greatest needs, including places where national economies are particularly fragile and where modern contraceptive prevalence rates are very low. In fact, 34 out of 54 countries where the Supply Partnership operates are facing humanitarian crises, and some faced multiple concurrent crises last year. Our goal, as always, has been very clear: to reach the most marginalized and underserved population up to the last mile. For us at UNFPA, this is not just a partnership. It is a global public good, one that is also a driving force for the achievement of SDG 3.7 and 5.6 to ensure universal access to sexual and reproductive health and rights in a world where these rights remain under threat. We know that this program brings value from both a right and an economic perspective. In fact, UNFPA analysis shows that every dollar invested in ending preventable maternal death and the unmet need for family planning by 2030 will bring economic benefits of more than $8 by 2050. As the head of the program at UNFPA, I'm particularly proud of three things about this program. First, it focuses on shared accountability for results and expansion of financing for family planning through new agreements that were formalized by 44 partner countries. Secondly, it's strengthening of end-to-end visibility for supply chains to ensure reproductive health commodities are delivered into the hands of individuals. And finally, its effectiveness in empowering women and girls to make informed decisions about their reproductive health, fostering greater access and autonomy by expanding the range of contraceptive choices and options for self-care. But we all know this is achieved by UNFPA alone. Throughout this webinar, you will hear just what we can achieve together. You will hear more about the new and innovative effort that the partnership is fostering with countries, donors, and private philanthropies to ensure that everyone, everywhere, can access and use quality assured modern contraceptive to plan their families and determine their future. We know this is just the beginning. We look forward to building on the successes of 2023 together towards even a greater impact in 2024. The supply partnership is definitely a priority for us as we commemorate the 30th anniversary of the ICPD Program of Action this year and prepare to mark the Summit of the Future in September. We plan to continue working with government and building partnership alliances to achieve ICPD's inclusive, equitable, and sustainable vision for placing people's dignity and right at the heart of sustainable development. And we are clear that no one actor can achieve this alone. UNFPA is committed in working with you all, with all our partners, friends, and community to make this possible. This is why I am absolutely delighted to introduce to you all Julia Bunting, a long-standing member of our community who has recently joined UNFPA as the director of a new program division. As many of you know, Julia's experience and dedication to advancing sexual and reproductive health and rights spans more than 25 years in both public and nonprofit sector, including her work spearheading the development and implementation of a transformative strategic plan as President and CEO of Population Council. Julia also served as the director for the program and technical division at the International Planned Parenthood Federation, IPPF, and spent over 12 years at the UK Department for International Development. Julia also chaired the Reproductive Health Supply Coalition for over 4 years, and I am confident that her expertise and leadership will be pivotal in helping us to achieve many future milestones towards UNFPA 3 transformative results. Julia, could you make a few remarks, please?
Thank you, Diene, for that kind introduction, and thank you, Pape, for chairing us today. I'm thrilled to be here at UNFPA, and thank you to Diene for inviting me to take on this really important role at this critical time in our work. I'm particularly excited to be now involved inside UNFPA with the Supplies Partnership, which is something that I've been involved in for probably 15, if not nearly 20 years now. During my early days at DFID, I was responsible with others for writing the very first investment and business case for the Supplies Partnership for phase 1 as it was then, and for the initial funding that the UK government committed back in 2007. And over the years, I've been privileged to be involved in the Supplies Partnership in various different ways. And I am thrilled now that I get to work inside UNFPA and to partner closely with all of you to see it go from strength to strength in this third phase of the programme. I'm particularly excited to join all of you today in seeing the incredible results and impact that the power of this partnership has had over the last year. So thank you, Diene, and very much looking forward to continuing to work with many familiar friends and colleagues who names and faces I see on this call today. Thank you.
Thank you so much, Julia. With that, I turn to our chair. Pape, over to you.
Thank you. Thank you, Jenny and Julia, for the inspiring remarks about the programs and for highlighting the power of partnerships and the need for sustainable financing. I am sure you will all agree that each one of those elements plays a crucial role in ensuring universal access to reproductive health and rights. Let me talk a little bit about the structure of our webinar today. And now, on the heart of the subject, our presenters today will be highlighting 3 key areas of impact achieved through the Supplies Partnership, focusing in 2023. First, we will look at how the partnerships has galvanized government commitment to domestic resource mobilization. We all know that our countries are tasked with this heavy burden coming from the request is coming from all sides. So we are very proud to be showing you today that we're having some successes in that area. We will understand how the partnership collaborates with key stakeholders to develop stronger health systems, including supply chain. Because the real legacy for us is to leave the countries with strengthened systems. And we are very proud to be sharing results in that area. We'll also look at how the partnership works to expand availability and choice of contraceptives and maternal health medicine. So let's get started with some key highlights from the 2023 UNFPA Supplies Partnership Impact Report. So the partnership is making significant progress toward achieving UNFPA's transformative results of ending unmet need for family planning and reducing maternal death. By reaching over 20 million women and girls annually in the lowest income countries with quality, modern methods of contraception and maternal health medicine. In 2023, the UNFPA Supplies Partnership averted 9.5 million unintended pregnancies, 200,000 maternal and child deaths, and 2.9 million unsafe abortions. Working with its partners, the Supplies Partnership is amplifying impact in 54 countries with the greatest unmet needs for family planning. As a leading global health initiative, the UNFPA Supplies Partnership is expanding availability and choice of quality modern methods of contraception. Partner countries accounted for nearly half of additional users of contraception in lower and middle income countries from 2012 to 2023. Through support from UNFPA Supplies Partnership countries are expanding the choices of contraceptives available to women and girls. In 2023, 9 countries introduced the hormonal IUD, 30 countries rolled out self-administration of the subcutaneous injectable, and 47 countries identified adolescent and youth access to contraceptives in their applications for health system strengthening support. The partnership also increased access to life-saving maternal health medicine, supporting 10 countries in 2023, to introduce new medicines to reduce bleeding after childbirth. The partnership's work has shown that domestic financing for family planning and reproductive health commodities can rapidly accelerate while partners work together and governments are working together with government are provided with strong technical support and incentive mechanism to enable a sustainable shift from funding to financing. 2023, in fact, marked the first year the partnership operationalized its new strategy and commitment to mutual accountability through the signing of country compacts. The compacts represent unprecedented political commitment to domestic financing, even in a lot of cases, unlocking first-time government contributions in some of the world's most fragile and conflict-affected states. Country compacts define roles and responsibilities and create greater transparencies and accountability, with the ultimate goal of ensuring deeper and stronger engagement by countries and their partners across the partnership. Another incentive mechanism for increasing domestic resources, i.e. the match fund, enables UNFPA to match government contributions to quality-assured reproductive health commodities. In 2023, countries committed to using $26.6 million in domestic resources in their compact, with another US dollar 13.5 million awarded in match fund. The partnership progress is headed in the right direction. But as everyone knows, we have so much more to do and so much further to go to ensure everyone, everywhere, can make decisions concerning their reproductive health that is free of discrimination, coercion, and violence. So, following those highlights, I would like now to introduce Matthew Cummins, UNFPA Health Economist, Regional Advisor. So, Matthews will speak in depth on health financing in West and Central Africa, with a focus on 2023 results, ongoing financial interventions, including the catalytic role of the Supplies Partnership and the future of domestic resource mobilization. Matthew, over to you. I think, yep.
Greetings, colleagues. My name is Matthew Cummins. I'm the Health, Economics, and Social Policy Advisor with UNFPA's West and Central Africa Regional Office, and it's a great pleasure to join this very exciting event to share some ideas about what we're doing in the health financing space and where we are trying to drive this agenda. So let's start with a quick overview of the main financing activities that are currently ongoing across our region. The first is no surprise to this audience, the match funds, where we are trying to incentivize governments to invest more into reproductive health commodities. Last year, all 20 of our eligible governments signed the compact, which was fantastic. However, we've only been able to validate expenditure in 7 countries, and of those 7, only 4 met the commitments that was within the compact. The second big intervention is investment cases. Again, another tool which is commonly used across UNFPA. In our region, we've supported almost 30 different investment cases in the past 3 or 4 years, about half of which have been focused explicitly on family planning. The challenge here is that close to 3 out of 4 of these documents were never finalized, and we have yet to find any evidence that an investment case has actually led to more or improved investments in any of the 3 TRs, including family planning. Beyond the compact in investment cases, many of our offices have been experimenting with other types of tools. Several offices have analyzed the budget statement. Some are contributing to national health accounts exercises. Quite a few have supported costing of different plans and strategies around family planning. One country office has supported a CSO to engage on budget advocacy. And perhaps our biggest recent and proudest achievement is that at the end of last year, UNFPA co-organized the first ever primary healthcare financing forum, which took place in Abidjan. And 12 of our country offices participated and supported both the Ministry of Finance and the Ministry of Health to develop a primary healthcare financing action plan with very specific roles for UNFPA to provide technical, analytical, and capacity supports. And those plans are currently being operationalized in most spaces. So a lot of other activities as well. In terms of results, having just gone through the different annual reviews across countries, a number of our country teams did report very impressive increases on investments in family planning and other areas, both in terms of the overall amount as well as a percentage increase. And we had 2 offices, specifically in Mali and Senegal, where our advocacy led to the government introducing a specific budget line on family planning as well as on fistula, which is a very significant contribution to institutionalizing the routine monitoring of spending in these spaces. So very big achievements. I would also note that for the countries that did fulfill the compact, you can see Niger, Senegal, Ghana, those governments went way above and beyond their initial commitments from the compact, which does show the potential big leveraging power of the compact as a health financing tool. So just to offer a few observations in terms of our current engagements on health financing activities, a lot of stuff is happening, most around compacts investment cases. We've had so not great results across the board, but we do have some really good examples. And of course, many stories are still unfolding. And the more important question for us is, how can we do more and better in this space, which is taking us into the next section, which will look at some of the ideas about how we're trying to move this agenda forward. Now, the dream, I think this is the dream across all regions, across UNFPA, is we want governments to invest better and more in family planning services so that we actually have a realistic chance of reaching zero unmet need by 2030. And the challenge that we face is a lot of very specific financing obstacles are in our way between that and the goal. A first major challenge, I think, which was illuminated by the challenges just in trying to validate how much was expended against the compacts, is that we don't have a good idea of how much governments are actually investing in this agenda. A second major challenge is the design of annual budgets for family planning services. In general, in our region, the lion's share of resources are going to procure commodities with very limited spending on expanding, strengthening the supply chain, or creating demand, awareness raising for different family planning products. So lots of opportunities to just improve the way that our health ministries are budgeting each year for this agenda. Another very important challenge is that most of our health ministries in the region are unable to spend the resources that they receive during the fiscal year. And as we get into the third quarter, and certainly the fourth quarter, in many countries, the Ministry of Finance, the Treasury is going into the Ministry of Health and taking back the resources that will not get spent and reallocating them to other ministries. And so our inability to spend a budget as intended is very much a fiscal space issue, because pouring more money down the spending chain is not going to increase results until we can actually spend well. And a lot of that is in procurement issues where UNFPA has a lot of technical value to contribute. Final two challenges are first around the low prioritization of health spending in general, as well as family planning. In our region, not a single government of our 23 countries is even anywhere remotely close to spending 15% of its annual budget on the health sector, according to their financial commitments in the Abuja Declaration. And then, of course, we have major funding gaps across the board. And so what we can do, we can look at each of these challenges and then turn them into a possible opportunity for our agenda. So one set of interventions could be around measuring and monitoring what the government is spending. Another set could be around helping the government to maximize how it uses, how it invests the resources that it has available every year. And the last area could be around supporting governments to increase spending on our agenda, including through more donor and funds from the international financial institutions. We can take those challenges and then further kind of transform them into a simple framework, which is now presented on the screen. I won't go into the details here because of time, but it's just to say that if we go one further step and map each of these 4 areas to specific tools and public finance reform processes, we now have a framework and analytics and processes to help guide where our countries can begin to expand their engagement in the health financing space, and also looking towards the medium and longer term and having a more cohesive strategy of where we're trying to move this agenda. Of course, I'm not going to explain all these tools and reforms, but I will highlight, for example, budget briefs, costing exercises, cost benefit analyses, fiscal space analyses. Those are all highlighted in the orange boxes. And those 4 tools are basically the core package of our investment cases alongside the match fund, which all country offices are working on. So we already have a lot of activity across the toolbox, and those yellow boxes are just highlighting some potential opportunities, easy, low-hanging fruit that could also help us to make a very big impact in the health financing space. At the country level, this could look like a simple strategy as is shown on the screen, where we are increasingly providing support to health ministries to help them design their budget, to identify and remove spending bottlenecks, and to bring in more resources. And at the regional level, we can also try to enable this agenda first by rolling out a regional expenditure monitoring platform. And just to note that Wakaro, together with 2 other regions, has submitted a proposal where we are going to hire a consultancy firm to find information, analyze information, and interpret and summarize that into very simple country financing dashboards that our teams can then use to engage throughout the budget cycle. Smart advocacy is another big regional enabler that was started last year in 5 countries and will be rolled out to an additional 15 countries, where we bring together Ministry of Health, Ministry of Finance, parliamentarians, UN agencies, civil society groups, and other private sector actors to talk about why more funding is not flowing into the family planning agenda and how we can collectively come together and shine a light on the need for more and better investments in this space. So that's also a very promising initiative. And just to note that both of those initiatives have been supported by funding coming from our supplies program globally, which is incredibly appreciated. And then lastly, in our region, we have demographic dividend observatories, which is part of a World Bank joint program that we're managing, which is another platform to really propel this agenda, and also the opportunity to increase our collaboration with both the UNCT as well as the international financial institutions on the overall health financing agenda. Final thoughts. We are way off course. The demographic pulse in our region means that every day more and more women have unmet needs for basic family planning services. Understanding how challenges affect the 3 TRs can help us have a strategic rather than an ad hoc response, and that's why we're trying to develop this overall regional framework. Some emerging priorities at the country office level are supporting the health ministry to design its budget, to fully spend its budget, and to bring in more resources. And then as a regional office, we're trying to enable progress and catapult this agenda through the expenditure platform, through smart advocacy, the demographic dividend observatories, and better collaboration with strategic partners A lot of this, again, is due to both pilot funds and expansion funds coming from the supplies program. So we're very grateful, and we look forward to continuing to share lessons and to talk about how we can be much more effective and impactful in our health financing interventions. Thanks again so much for the opportunity to contribute to this event, and I'm very happy to pass the floor back to New York.
Thank you. Thank you very much, Matthew, for the rich presentation. I'm sure our friends are gearing up for lots of questions. So thank you for your patience while we go through the program. Let me now allow me to introduce Dr. Tom Sesay, who is the Director of Reproductive Health and Child Health in the Ministry of Health and Sanitation in Sierra Leone. Tom has over 20 years of experience in the health sector in Sierra Leone, during which time he has served in various capacities, including as medical superintendent and as district medical officer. Please welcome Dr. Sesay to speak about Sierra Leone's specific commitment to strengthening family planning. Dr. Sesay, over to you.
Yeah, thank you very much, Pape. Thank you so much, colleagues on the call and colleagues, ladies and gentlemen. I'm Dr. Tom Sesay, as has been said. I'm the Director for Reproductive and Child Health in the Ministry of Health. We no longer have the sanitation bit that has been taken off to another ministry. So Sierra Leone is a very small country, about 8 million people, but we have very strong commitment, to strengthen family planning as part of the Family Planning 2030 agenda commitments. And it's also articulated in many of our strategic documents, including our midterm national development plan, the reproductive, maternal, newborn, child, and adolescent health strategy, and all of our other strategic documents. And also, there is a focus on transforming harmful and social gender norms and attaining sustainable financing for family planning and sexual reproductive health issues. Of course, we have made some gains as a country. Modern contraceptive use has tripled since 2008. Currently, we have about 640,000 current users of modern contraceptives. However, the unmet need remains persistently high, and only about 56% of the total demand for family planning currently is satisfied in Sierra Leone. Through inclusive national and subnational deliberations and costing exercises, we have been able to put together an investment envelope of about $36 million for a 5-year period that would help us to achieve the country's family planning target. Commodities actually account for about 40% of this cost, of course, but importantly, if this investment is made, we will be able to avert about 1.4 million unintended pregnancies and over 500,000 unsafe abortions and over 11,000 maternal deaths. So as much as the costs are high, but it is very important, and it could be cost-effective or efficient expenditure. Of course, the government values the long-standing partnership with UNFPA, of course, not only in providing the yearly supply of quality, essential, and life-saving reproductive health supplies, around about 90% of the national requirements for family planning and SRHR commodities are provided through UNFPA support. And of course, this is going to have a very important impact on women and girls, particularly for women and girls, and mostly for those in disadvantaged communities. We have had the compact signed, the multi-year compact. It has been signed with Ministry of Health, Ministry of Finance, and UNFPA. Of course, the Ministry of Finance has also created a budget line for support to family planning. So that is very good progress. There is also small and yet significant stride amongst in the midst of so many priorities that the Ministry of Finance has got. And that reaffirms an unwavering commitment to the partnership's vision of ensuring universal access to sexual and reproductive health in Sierra Leone. Of course, this is a major precedent. It has not happened before that we'll have a budget line for family planning, so that is something that is a major achievement, and it solidifies national ownership in financing sexual and reproductive health. And we therefore applaud partners for their steadfast dedication and support as we embark on this journey. Of course, we review the compact on a regular basis, and it's re-signed on an annual basis. So far, it has been signed twice in 2023, and it has just been signed in 2024. And it is also creating an awareness in the Ministry of Finance about the importance of having a budget allocation for family planning. Of course, it takes time. The fact that, for example, when there is change of government or change of ministers, for the new people that come assume office, to understand the implications and the importance of this issue. But the good thing is that we are now having follow-up questions that come to the Ministry of Health. Okay, can you explain this further? Can you provide supporting evidence or documentation to be able to support these payments? So that is something that we think is also important, because it's now becoming mainstream in the discourse at the Ministry of Finance. Of course, additionally, in collaboration with the UNFPA and partners, national mechanisms are supported to improve national capacity to regularly assess and quantify reproductive health commodity needs and logistic systems for delivery of these commodities, family planning commodities, to the last mile. Of course, in an attempt to be able to get sustainable commitments and to increase and diversify financing for family planning, we have worked together to put together an investment case. It has been drafted, of course, and we've had consultations with stakeholders, but we'll have to ensure that it's validated at some point. The last time when we had the Sexual Reproductive Health and Rights Conference, it was also discussed in that forum. So the investment case analyzes the current government spending on family planning, the investment required to reach the country goals, family planning goals, the cost-benefit ratio, and the cost of inaction, as well as proposed financing options to fill the gap. And advocacy efforts will continue based on the evidence to further improve domestic resource mobilization and efficient use of available resources. So in a nutshell, for Sierra Leone, financing of family planning as a line item is relatively new at the level of the Ministry of Finance, but I think it's been internalized, it's been institutionalized, and I think we now have a forum where we engage on a regular basis with the Ministry of Finance for them to understand better, and I think that bodes very well for sustainable financing in the long term. So on that note, I want to say thanks to UNFPA and partners and donors for the support that has been provided, which has contributed to the gains that we have seen in terms of a contraceptive prevalence rate. We still have a long way to go, but I believe that we are on the right trajectory. And I think with sustained support, we'll be able to meet our targets for the SDG and other strategic targets that we have. So thank you so much for listening.
Thank you, Tom, and thank you for providing us with an opportunity to have a look, laser-focused look at the country level. The Supplies Partnership also complements national efforts to build stronger integrated health systems by investing in supply systems that are more functional and more resilient, especially in humanitarian setting or context. I will now give the floor to Lydia Porto, Head of Country Office Support and Monitoring Team, Supply Chain Management Unit of UNFPA, who can speak more directly on key achievements, lessons learned, and remaining challenges in health system strengthening and supply chain. Lydia, over to you.
Thank you very much, Pape. My name is Lydia. I work in our supply chain management unit, UNFPA in Copenhagen, heading the team that's working on last mile assurance and supply chain strengthening. Good morning, good afternoon, good evening to all. It's such a pleasure for me to be here and to speak on some of the work that we've done in 2023, particularly in partnering to strengthen health systems and supply chains. UNFPA organized, if we go to the next slide, priorities for strengthening of supply chains into 6 areas, which are based on WHO's health system strengthening building blocks. Now, these 6 building blocks that you see here, they contribute to strengthening of health systems in different areas. And the interventions that UNFPA is focusing on when it comes to strengthening of supply chains is also divided into these areas. And in today's presentation, for the sake of time, I'm going to focus on the activities and the results that we've had in the area of health information systems. So the 3rd building block in yellow on the slide. Next slide. If we look on the right-hand part of the slide, we can see that the total budget allocated for transformative actions in 2023 was just under $10 million. These $10 million supported 53 countries in the partnership across 5 regions, and several of those applications included interventions on installation and upscaling of electronic logistics management information systems and training of personnel. This because of the impact of sound inventory management systems. It's really increasingly evident that countries can't adequately manage their supply chains or guarantee adequate supply levels at different levels of the supply chain without an accurate and robust and integrated inventory management system. We have here highlighted the example of Zimbabwe, where last year they received $94,860 through the TA, now the HSS funding, for ELMIS implementation. The country, in partnership with 2 other organizations, rolled out ELMIS and trained personnel in 800 facilities. And UNFPA's contribution went towards 150 of those facilities. And to date, UNFPA has supported implementation of ELMIS in 450 facilities in Zimbabwe. So this is 2023. If we go to the next slide, also in 2023, UNFPA redesigned the last mile assurance process. There was some questions in the chat regarding what UNFPA is doing to ensure that our commodities reach the last mile. That's at the core of the last mile assurance process, where really our aim is to collect data on supply chains, see where are the gaps, where do we need to strengthen those gaps, and work with partners and governments on implementations of recommendations for supply chain strengthening. So when it comes to health information systems, last year we worked with countries in the partnership and beyond to see how many health facilities at different supply chain levels have fully implemented an ELMIS system. So on the left part of the slide, we can see here information from all of the supplies countries showing that ELMIS is fully implemented in 50% of countries. At the decentralized level, that number goes down to 32%. And at the service delivery point level, we go further down to 9%. The graphs on the right hand of the slide shows data collected from 38 in-country assessments, so on-site assessments that we did in supplies countries, showing the functionality of ELMIS systems at different levels of the supply chain and the functionality of internet connectivity. So we can see here, based on these assessments, that ELMIS is functional in 73% of the central warehouses that were visited, in 54% of decentralized warehouses, and then in 20% of service delivery points. And the data that we gathered on functionality of internet connectivity is closely aligned with that of the ELMIS, but we can see that beyond the central level, internet connectivity is not always reliable, which is paramount for the functioning of an ELMIS. Next slide, we can see here. So it's one thing to have an ELMIS system. It's another thing to adequately use that system. And so here we can see one of the LMA process activities that was carried out throughout 2023. It's a little bit difficult here with the information in the circles, but I'll try to clarify. So here, through the quarterly stock reviews, we worked, when it comes to the partnership countries, with 94 partners in 43 countries. Every quarter, a physical stock count was done, and partners reported on different stock parameters, which allowed us to see how are the inventory management practices, and also to diagnose, is there a need for additional commodities? Are commodities at risk of stock out? Are they at risk of expiration? Have they expired? And we can look at other types of loss as well for management of those inventory practices, and then to see where ELMIS is implemented. Is it being used? Are facility personnel trained? And is the data that comes from the QSR used for decision-making in countries, such as quantification? We can go on to the next slide and see that here we also partnered with ministries of health and other partners in partnership countries. Here's the data from 38 countries that we visited in 2023 to identify the need for ELMIS implementation and expansion, and also for training of facility personnel. So here you can see the number of warehouses at the central level that were visited, at the decentralized level, and then SDPs that were visited, and then the approximate number of personnel that were trained during these on-site assessments. We can go on to the next one to circle. Yes, exactly. And then here it's pictures from those in-country assessments, just to put a face on some of these activities that we've done. The pictures represent assessments done in Burkina Faso, Bolivia, in Nepal, Mozambique, Mali, and Kenya. And a lot of these is showing the work that's done partnering UNFPA with partners on the ground, facility personnel, and the involvement of all the stakeholders in the assessments, including mentoring of facility personnel on the findings from those assessments. The next one, thank you so much. Going back to where we first started around budget allocation for health system strengthening, particularly in the area of supply chain strengthening. For 2024, we have allocated just over $10 million for supply chain strengthening. There's all 54 countries in the partnership that are supported across 5 regions. And once again, included in this budget are interventions on ELMIS, installation, upscaling, and training of personnel. Going back to the example of Zimbabwe, the budget this year is just under $120,000 for implementation of ELMIS in 300 facilities at the service delivery point level. And the expectation is that this intervention is going to impact heavily the availability of information for decision-making, not just in these facilities, but overall in the supply chain and in the region. And what's important to highlight here is that the LMA process activities, which are designed really for us to collect and analyze and disseminate SCM data to key partners, was used in the allocation decisions in terms of what are we prioritizing for interventions around system strengthening, and then what is the budget that's going to be allocated to ensure that the funding and the interventions are sustainable. When it comes to the example, we have many other examples in the other 5 areas of strengthening, but in the particular example of ELMIS systems or ELMIS systems for inventory control, 1 year investment is not enough. So here in the example of Zimbabwe, we've done a lot of work. It's great, and we can see the results in terms of how stock is managed in the country. We still have a very long way to go. So that's part of the challenge that we face, is to ensure that the funding is sustainable, that we're partnering with other organizations, as was the case in Zimbabwe, and to ensure that our efforts around ELMIS are integrated and that we're doing so in partnership and with the end sight that's sustainable, because we can't stop. The investment in terms of financing and training and so on needs to be continuous. So I think when it comes to system strengthening efforts around ELMIS and the connection with the LMA activities, I can leave it here. But we will show now a video from Dr. Ivo Flores, who is the head of the Department of Standardization of Care for Individuals in the Ministry of Health of Honduras. And Dr. Ivo describes his experience building national efforts to integrate health systems by investing in supply chains. And it's interesting to note that Dr. Ivo touches upon the importance of a strong information management system for a resilient and integrated supply chain, as we just discussed in this session. So with this, I say thank you so much for the opportunity to be here, and I hand it over to Dr. Ivo Flores. Thank you.
Ivo Flores de la Secretaría de Salud de Honduras, coordinando el Departamento de Normalización de Atención a las Personas. Y es un gusto realmente poder participar de esta entrevista para brindar nuestra opinión sobre los desafíos y la ayuda que hemos tenido por parte de la cooperación del UNFPA. Para hablar de los principales desafíos que tiene la CESAL para garantizar el acceso a métodos anticonceptivos y medicamentos, podríamos iniciar diciendo que entre estos desafíos está el fortalecer la cadena de suministros de la Secretaría de Salud. ¿Por qué digo esto? Porque actualmente hay algunas fallas en cuanto a esta cadena en los tiempos para asegurar la compra. Los técnicos y la Secretaría de Salud deben de tener un poquito de mayor información y coordinación para para que los tiempos sean los correctos y se pueda hacer tanto la solicitud como la adquisición, el recibo, la distribución y la entrega en cada uno de los establecimientos de salud de la manera adecuada y correcta. Entonces, es importante en el entendimiento de toda la cadena de suministros que es importante fortalecerla. Otra de los desafíos está en el sistema de información de la Secretaría de Salud. Y aquí fortalecer lo que podríamos decir el sistema automatizado control de inventarios, o SASI, que viene a ser como un subsistema que es parte de este sistema de información de vital importancia para poder tener control de lo que recibimos, de lo que entregamos y de las necesidades que tenga el país. Entonces, es importante mantener y fortalecer este sistema de información que, dicho sea de paso, está siendo muy apoyado y la Secretaría actualmente está tratando de que funcione adecuadamente. Otro de los desafíos es la operatividad de la guía para operativizar los servicios de planificación familiar. Esta guía ha sido elaborada para mejorar todos los componentes que tiene que ver con planificación familiar, desde la programación, el monitoreo, la capacitación, la organización de los servicios, todo tratando de garantizar el buen funcionamiento de todo lo que viene a ser el programa de planificación familiar. Otro de los desafíos es asegurar la utilización del renglón presupuestario para la compra de métodos anticonceptivos. Es importante recalcar también acá la utilización de la herramienta de FAMPLAN. Podríamos decir, garantizar todo lo que se necesita hacer para que la población reciba tanto los anticonceptivos como los métodos. Esos creo que serían los principales desafíos que tiene la Secretaría de Salud. Y luego, pasando a la siguiente pregunta, que son los logros que la Secretaría de Salud ha obtenido con la asistencia tanto técnica como financiera del UNFPA, van muy ligados a los desafíos. ¿Por qué? Porque, por ejemplo, el Sesay, la guía para operativizar los sistemas de planificación familiar, han sido apoyados técnicamente por el UNFPA. Entonces, este conocimiento, este caminar y este trabajo hombro a hombro realmente ha sido fabuloso para la Secretaría de Salud, puesto que han dado esa asistencia técnica de acuerdo a las necesidades que tiene el país en estos temas. Otro de los, bueno, la cadena de suministros es parte de esta guía para operativizar los servicios de planificación familiar que ha sido mencionado, apoyado por el UNFPA. Lo de la herramienta de FAMPLAN, consideramos una herramienta súper actualizada que nos ha permitido poder saber con exactitud las necesidades en cuanto a anticonceptivos que se necesita año por año y poder tener las capacidades financieras para poderlos adquirir. Creo que esto es los principales desafíos y la asistencia, los logros que hemos tenido con la asistencia que el UNFPA nos ha brindado a través de los años. Diría yo, bueno, creo que en mis 32 años de trabajar con la Secretaría de Salud he tenido la oportunidad de tener esta asistencia técnica y que nos ha facilitado mucho el trabajo.
Okay. Thank you so much. Let me rush to introduce Agnes. So the partnership is a global health initiative and the world's primary vehicle for expanding access and choice to contraceptives and maternal health medicine, ensuring last mile delivery. Agnes Chidanyika, technical advisors in UNFPA's family planning branch, will now join us to present key achievements, lessons learned, and remaining challenges in expanding access and choice. Yes.
Thank you, Pape. Good morning, good afternoon, everyone, and glad you could join us on this webinar. Next slide, please. Next slide. Thank you. Ending unmet need for family planning calls for access to contraceptive methods. There are many different types of contraceptive methods, and choosing which method to use depends on various factors such as personal preferences and fertility decisions. Such decisions can only be made when there are options for women to find a method that is more appropriate for them and their needs. However, we know that access to contraception faces a number of challenges which are out of women's control. Some of the barriers are related to policies and the enabling environment, limited access due to limited availability of the product itself or skilled providers. The recommendation is to have at least 5 methods available to allow for choice. All this must be done in an environment that prioritizes the quality of information and services. And we have seen that when some of these barriers are addressed, there is improved access. Next slide, please. In the UNFPA Supplies Partnership program, we have been promoting widening the range of options women can select from. We see in most facilities where 3 methods are available, there is limited access to preferred methods. Access to contraceptive methods must be done in line with human rights-based approaches to facilitate informed decision-making, prevent coercion or bias in promoting of certain methods over others. Quality of counseling and information is known to have an impact on continued use and increased knowledge on the options. Our work with governments to develop or update family planning policies is really critical in creating an environment that allows for use of high impact practices and evidence-based practices in family planning. Although a lot remains to be done, we do like to celebrate some steps in progress. Targeted efforts in some countries, for instance, has resulted in some increase in access for hard-to-reach populations, especially those in rural areas, and access for young people. Next slide, please. Just a few highlights. In addition to procurement, and Pape covered these in his opening remarks, some of these achievements. So I won't repeat them, but just to highlight that these new contraceptive and maternal health medicines are from the new and lesser used product fund, which we set up to allow countries to add more choices into the method mix and standard treatment guidelines. The program has a robust health system strengthening component with interventions ranging from guideline development, for example, support on development of self-care policies that has been happening in countries, rollout of training resources for providers to support improvements in the quality of care and services, and then generating evidence for implementation of evidence-based strategies. For example, barriers to rollout of self-injection contraceptive method. Next slide, please. We have gathered a number of learnings over the years since we started introducing implants and then the other new products that we are introducing. And as we expand access, it is important to take stock and ensure context-specific factors are being considered and being addressed. Capacity of the health system, timing of procurement to ensure product is available when it is needed, and the service delivery readiness. It is important not to overlook integration of these new products into the national systems, especially data tracking and monitoring. It is always great to hear from the field and appreciate the context and the complexities. South Sudan is one of the countries that has not only been expanding contraceptive options, but was one of our pioneer countries. We conducted implementation research on the introduction of heat-stable carbetocin, a maternal health medicine to prevent postpartum hemorrhage. So we will now show a video from Kadra, who is the maternal and child health coordinator with the International Rescue Committee. The International Rescue Committee is one of the UNFPA's implementing partners in South Sudan. In this video, Kadra will focus on the introduction of DMPA-SC, a subcutaneous self-injectable contraceptive to expand contraceptive options in South Sudan. Thank you. I hand it over to Kadra Noor.
Today, I'm delighted to share with you our experience on expanding access to contraceptives in South Sudan. Just to start us off, a brief overview on the South Sudan context. The protracted civil war in South Sudan has weakened the health system, and seasonal flooding, climatic shock, and acute food insecurity have also had a huge impact when it comes to access to quality life-saving reproductive health for vulnerable population in the society. And this has contributed to one of the worst reproductive health indicators in the world. So as part of IRC global strategy, which spans the humanitarian development nexus, IRC provide family planning through integrated and holistic approaches by expanding access to sexual reproductive health in underserved communities of South Sudan. We are in 2 states of South Sudan and provide these services across 10 field locations. And over the years, we've been able to reach out to over 258,000 women and girls, including 87,000 adolescent girls with family planning services. So we deliver services through 3 main channels, and these are facility level or static level service delivery. We also have outreaches and community-based distribution as a model that we use to deliver family planning services in the hardest to reach populations of South Sudan. In my slide on the right-hand side, you'll be able to see the contribution of different models of channels that we deliver our services with. We started our community-based distribution during the COVID-19 era to be able to reach out to populations that were not able to access health facilities. And also this coupled with the cultural acceptance of family planning and the unavailability of trained healthcare workers in South Sudan being very low. We identified community-based distribution as a strategic channel to reach more people and clients, especially for first-time users. In this, we have been able to see a tremendous increment in terms of clients accessing family planning services through this channel. So these slides represent the South Sudan DMPAC self-injection journey, which revolves around introduction and advancement of DMPAC self-injection, contraceptive methods that has been proven to empower women to take control of their reproductive choices. Firstly, the addition of DMPAC to the South Sudan Essential Medicine List in 2018 was a pivotal moment for South Sudan, and this was because it aimed at recognizing the importance of addressing the unmet needs for women and girls in the country. In January 2022, the IRC the IRC Ministry of Health and UNFPA led a design phase of the pilot study, which commenced, and this aimed to lay a foundation for a rigorous research and evaluation to ensure safety and acceptability of self-injection. As part of this process, a feasibility and acceptability study was conducted between 2022 and 2023. And this study provided invaluable insights into the acceptability and demand for self-injection in the country. Simultaneously, a comprehensive review and update of the existing national family planning policy was undertaken, and this aimed to reflect the evolving landscape of reproductive health care, in addition to incorporating newer methods like DMPAC into the policy system. And building onto the foundation of the research that was conducted, we were able to complete and disseminate findings of this research. Furthermore, the Ministry of Health in South Sudan has reviewed the community health strategy in early 2024, and this ensured inclusion of the DMPAC self-injection, and this aimed to recognize the importance of community-level engagement and community-based distribution as a key channel for reaching hard-to-reach populations. After careful considerations and planning, self-injection was initiated in South Sudan as a soft launch, and this allowed gradual implementation and monitoring of uptake and impact within South Sudan. In addition to this, ultimately, the Ministry of Health envisions to develop a comprehensive national scale-up strategy to introduce DMPA self-injection, ensuring equitable access for these life-changing contraceptive methods. In conclusion, our DMPAC journey with UNFPA and Ministry of Health is a true testament of the MOH and partners' commitment in advancing reproductive health and empowering women to make informed choices about their reproductive bodies and future. So our partnership with UNFPA has been instrumental in strengthening our supply chain system and expanding access to essential reproductive health supplies. UNFPA in South Sudan has played a crucial role in supporting our efforts to ensure a reliable access to essential supplies for reproductive health services and reducing stockouts and ensuring continuity of care for our clients. In collaboration with UNFPA, who has been a strategic partner, we have aimed at advancing our reproductive health to improve reproductive health outcomes in South Sudan. So UNFPA in South Sudan has also brought in a valuable technical expertise when it comes to procurement and supply chain management, and also quality assurance to enhance availability and accessibility of supplies. Its quality assurance mechanisms have guaranteed safety and efficacy of the supplies, and this has instilled confidence in the products that we provide to our clients. In addition to this, UNFPA has been instrumental in providing financial support that has supported us to procure essential supplies, strengthen supply chain system, and expand access to reproductive health and family planning in underserved communities in South Sudan. The technical assistance through capacity building that we have achieved through UNFPA has enhanced our capacity in supply chain management, and this has enabled us to optimize our quantification process to ensure we have adequate commodities for clients in need.
Okay. Thank you so much. I think we're gonna, oh, looks like I'm not able to get on the video, but I hope you can hear me. Thank you, Agnes and Kadra. I'd like now to introduce Chris Carter, Deputy Director and Head of Human Development Department at the United Kingdom's Foreign and Commonwealth Development. Chris?
Thank you, Pape, and good morning, good afternoon from a very rainy London. I'm aware of time, so I'll try and be concise. So I'm talking about, we've talked already quite a lot about financing, but I'm talking about financing, family planning going forward. Financing has always been political, and it's going to be increasingly political going forward. We all know that financing has to come from domestic budgets in the future. I'm happy to say that UNFPA Supplies Partnership also knows that, and it's had really impressive results on domestic financing in the first year of its new strategy on domestic finance. We've heard quite a bit about that work from Matthew, from others, and I've noted some of the successes, but let's just recap on some of the highlights. 44 countries have signed commitments in 2023. 44. UNFPA Supplies Partnership has unlocked for the first time contributions some of the most fragile and conflict-affected states. There may be small contributions, but that's so significant. The country compacts define roles and responsibilities, they support transparency, and they build in accountability. So now we need to consolidate that progress, we need to keep learning lessons, and we need to keep up that pace of progress. So that's the future, but we'll be foolish if we didn't recognise that donor funding will have to remain a critical element of the financing picture in the medium term. There is still such a long way to go. It is the wrong time for donors to step back. It's estimated that there are 275 million women who want to avoid pregnancy who are not using a safe and efficient and effective family planning method. And we know that the need for family planning is increasing faster than the rising number of women of reproductive age. So the challenge is enormous. A new UNFPA Supplies Partnership is essential because only in partnership can we accelerate access to and maximize use of financing. UNFPA Supplies supports equitable access to sexual reproductive health. So it works towards meeting the unmet need for family planning in the fairest possible way. The UK recognises this, and we're a massive supporter of UNFPA Supplies Partnership. We also recognise the importance of this whole agenda, and how important it is for women's rights, but also economic development and for societies going forward. The UK's Foreign Secretary, David Cameron, has said that galvanising action and finance for sexual reproductive health and rights is one of his top priorities. Not a secondary priority, one of his top priorities. He is going to be doing all sorts of action this year. We're looking at broadening the political coalition supporting SRHR in the face of rollback. And the UK will continue to speak out strongly against rollback. We'll be supporting ICPD at 30 with a side event, and looking at how many of our partner countries we can get onto a platform to support it. We are going to be pushing hard on funding. The UK itself will set out some really large funding commitments this year, and we will use that to try and leverage other donors to raise significant amount more finance for SRHR. Alongside that, we're going to be working with countries on domestic resource mobilisation and commitments. As I said, the really central part of this. The other two aspects I won't have time to say too much about, but they're countering disinformation, and we see UNFPA as a partner there, and also, of course, galvanising the private sector. So that's showcasing innovation, asking companies to protect SRHR in their own workplaces, and increasing access to SRHR commodities where the private sector plays such a critical role. So it's going to be a big year, and I'm very happy and always repeat how important UNFPA is as a partner for the UK on this agenda. Thank you very much, and thank you for this webinar.
Thank you so much, Chris. And thank you for sharing more about the UK's commitment to comprehensive sexual and reproductive health. As if I want to remind our audience, the UK is one of the longest standing donors to the UNFPA Supplies Partnership and remains its largest contributor to date. But this partnership is much more important than just the financing aspect. We greatly appreciate the technical leadership and collaboration with donors, such as the UK, that have shaped the program to ensure its delivery for even the most marginalized women and girls. Thank you again, Chris. Unfortunately, we ran out of time, as you all noticed. So if you allow me just to say a few words to mostly thank. We've tried to answer the question as we go. I think our team has actually done a good job. So I encourage you to continue to reach out. This forum is obviously open, and make sure that your questions were answered. But thank you for the lively presentation. Thank you for our presenters for sharing their valuable insights, and to all of you for joining. We hope you leave the sessions today with a better understanding of what role the partnership as a flagship UNFPA program plays in achieving universal access to sexual and reproductive health. As we've noted throughout, the partnership is a global health initiative and the world's primary vehicle for expanding access and choice of contraceptives and maternal health medicine. As Diene said in her welcome remark, we must approach this work with urgency and seize every opportunity to achieve ICPD's inclusive, equitable, and sustainable vision. That we must. Thank you all for joining us today. And sorry it has run out a little time, but the content was so rich. And thank you for what you do every single day to support sexual and reproductive health services for girls, women, and vulnerable communities. Thank you very much.